an issue that concerns everybody, but particularly those in the global south. But it is a global issue, and it's important that as pharmacists, we see how we can continue to support malaria prevention and control, which is why we've put together this webinar. The FIP, together with the AMR Commission, has put together this webinar to engage all of us, and we have some expectations that we can look forward to by the end of this webinar. My name is Yvonne Yirenkyiwaa. I am Rector of the Ghana College of Pharmacists, and I'm also a member of the FIP AMR Commission, and I'll be moderating this webinar for us, taking us throughout the program, hoping that when we have finished, we would all have taken something with us. So this webinar is being recorded and live streamed via YouTube, and the recording will also be available on our website, FIP website. If you have any questions at all, we have a question box which has been provided. Please put them in, and we will be answering them as we go along. We also have, we've provided the opportunity for you to give us feedback on this webinar through the webinars@fip.org link. And we also encourage that everybody here, if you are not an individual member of FIP, this is a good opportunity for you to be an individual member and enjoy the benefits, see what is going on, participate actively, and make your contributions available. You know, let us learn from you, let us receive of you as pharmacists across the globe. So there's a new feature which we hope will be beneficial to some of our participants, at least. You can turn on captions so that maybe the speakers are speaking too quickly. You need to read to follow. That's an opportunity that's available. So please use it. You can also in using the captions, you go to captions, you go to translate, and then you can get your language of choice if English is not your first language, or English is not the language that you prefer to listen to this webinar in or participate in. Please go ahead and follow the steps as provided on the screen, and you will benefit completely from this webinar. So today's program, we've already started. Welcome and introduction. And we will have three wonderful presentations. We'll look at global strategies in malaria prevention, looking specifically at innovations in diagnosis and treatment. Then we'll look at the supply chain and see how building a resilient supply chain system will help us ensure that we have reliable access to malaria diagnosis and medicines. And then we'll look at strengthening the role of the pharmacists in community engagement. So with that, we'll look at pharmacists totally, and then we'll also look at pharmacists particularly in the community. We will have time for Q&A, so please, once again, use the questions box. If you also need to use the chat, that's fine. Our presenters will be looking at it. If you have specific questions to specific presenters, go ahead, identify them, and put your question in the question Q&A. I'm sure some of them will be answered as we go through the presentation, but go ahead and put them there. And the questioners, the presenters will also respond to some as we go on. We want to make this as interactive as possible. And then when we're finished, we will wrap up and say bye-bye to you until the next webinar. So we are hoping that when we have finished, we will have an understanding of global strategies and the latest inventions that we can use, and maybe the information that we need to have to communicate effectively, and also to identify the challenges and strategies for ensuring a resilient supply of malaria diagnostics and medicines in communities. Then we want to look at the role of the pharmacists, and we want to focus on awareness creation and preventing disease progression in communities. And when our last thing will be to gain practical knowledge to provide effective care for patients, because we are not only engaging them in the community, we are not only speaking to them on what they need to know, but we will also be part of their management, the management of their community, of their conditions. And so it's important that we have that knowledge as well. I know that as pharmacists and pharmaceutical care providers, this will be something that we'll be doing, but it's important that from time to time, our information is sharpened with new information, and even we are reminded of the old ones. And so this is just a snapshot of the moderator and our panelists for today, the people who will be leading this program for today. Lilyana, Dayo, Kunle, Rotimi, and Olushola Onanusi will be joining me. And so we move on directly, and let me introduce our first speaker for today. Our first speaker is Lilyana Dayo Kisumu. Lilyana is a seasoned public health expert with over 20 years of experience in health system strengthening in Kenya. Her expertise spans health program management, malaria control, reproductive and maternal and child health. Lilyana is currently the malaria program manager in Kisumu County and has also served as director of public health and UHC focal point, and has chalked significant successes in this role. An experienced researcher, Lilyana has led studies on malaria, HIV, and maternal health, and published on data use in UHC and socioeconomic determinants in malaria. She holds an MSc in health economics and policy, a BSc in public health, a diploma in epidemiology and clinical training. She has also completed leadership programs, and she will be speaking to us on global strategies for malaria prevention, innovations in diagnosis and treatment. So Lilyana, please take over.
Thank you very much, Dr. Yvonne, for the warm introduction. Good morning, good afternoon, good evening from wherever you're watching from. My name is Lilyana Dayo from Kenya, and I'll be taking us through some of the global strategies that are available for malaria elimination, with a lot of emphasis on diagnosis and treatment. Welcome. So a brief introduction. As we all may be aware, malaria is a life-threatening disease caused by Plasmodium parasites and transmitted via Anopheles mosquitoes from one person to the other. Globally, it is estimated that about 247 million cases are experienced every year, and with an estimated 619,000 deaths. This is according to the WHO reports of 2021 and 2023. 90% of the global cases and deaths occur in sub-Saharan Africa, with children under the age of 5 accounting for more than 60% of the deaths. So, about malaria burden in Africa. Nigeria, Democratic Republic of Congo, Uganda, Tanzania, and Mozambique bear the highest burden of malaria in Africa. Nigeria specifically accounts for about 25% of the global cases. In 2021, it is reported that 247 million cases were from Africa. Efforts like ITNs, that is insecticide-treated nets, and use of antimalarials are helping, but we still experience challenges due to healthcare access and poverty in some parts of the country, of the African countries. The map on your right demonstrates the burden of malaria transmission, and the reddest part is the area where we expect high transmission of malaria in Africa. About the socioeconomic impact of malaria in Africa, it is estimated by some researchers that about $12 billion are spent in healthcare in management of malaria. Of course, this is in addition to the lost productivity that is experienced when people suffer from malaria. It does cause a lot of lost work days and school absenteeism in children, and it impairs education and cognitive development amongst the young ones. It increases poverty, especially in low-income communities, and reduces agricultural productivity, since most of the sick members have to spend their time at home or in hospitals. It does also interfere with foreign investment and tourism. On your right, once again, you can see two maps. The first map estimates the world burden of malaria, and you can see the most colored part in blue is the areas that are affected by malaria, mostly in sub-Saharan Africa, some parts of South America, and Southeast Asia. When you look at the next map in red, you can see the most parts which are red are the areas which are most of the time reported to have high poverty index. So in summary, there is a possibility of a relationship between malaria burden and high poverty in some regions. Some of the global malaria elimination strategies that are available include: one, to have a malaria-free world by 2030. WHO intends to eliminate malaria in 35 countries and reduce malaria deaths by 90% compared to the 2015 baseline. It also aims to have 0 malaria deaths reported globally. In summary, the global malaria strategy focuses on prevention, diagnosis, treatment, and surveillance of malaria. The role of global partnerships. One of them is policy advocacy, where countries are encouraged to develop policies that can provide an environment conducive for prevention of malaria, treatment, and surveillance. It also encourages governments to ensure that adequate funding is allocated for malaria control and elimination. Of course, coordination and collaboration between partners, governments, and the implementing sectors. A lot of research is also required because of the changing behavior of both the vector and the parasite, including the host, and a lot of investment in health system and strengthening. All these efforts, when put together and applied appropriately, will contribute to driving malaria elimination globally. When it comes to innovations in malaria diagnosis, the focus is on improving the speed, accuracy, and accessibility. Traditionally, the diagnostic tools we have include microscopy and the use of the rapid diagnostic tests for malaria. However, we have recent advancements, which includes the use of molecular diagnostics, which are PCR-based tests. We also have digital tools where we have artificial intelligence and mobile diagnostics that can be able to accurately diagnose malaria. And of course, field-based innovations, for instance, the use of smartphone apps for diagnosis. Innovations in malaria treatment. The aim of malaria treatment innovation is focused on improving the effectiveness and addressing resistance that has been reported in various parts of the world. The current standard treatment is mostly artemisinin-based combination therapies, commonly referred to as ACTs, and they remain the primary treatment at both community and hospital level. We are currently having emerging treatments. We have new drug classes that are available, and also vaccines such as the ones of RTSS malaria vaccine, and the R21 matrix for malaria. We also have vector control innovations. One of them is the use of the insecticide-treated net and indoor residual spraying, but we have challenges since insecticide resistance has been reported in several parts of Africa. We also do have the genetically modified mosquitoes, where we use the sterile insect technique, and larval source management, where new tools are being employed to reduce the breeding of the mosquito. So about digital health and data solution. We have mobile-based platforms that can be used for malaria prevention, diagnosis, and treatment. We do also have the use of data, where we have big data and surveillance, where in some countries we have malaria indicator surveys that are done, some after every 3 years, some 5 years, depending on availability of resources. We also have the routine data platform, the district health information system. We also have the EpiInfo and the Google Earth engine. We also have telemedicine being applied in some parts of the continent, which helps them to be able to access communities that are not able to reach the hospital through remote diagnosis and treatment using digital platforms. About community engagement and education, we do have community health workers in most parts of the continent who are trained and equipped with the commodities to be able to test and treat household members suffering from mild or uncomplicated malaria. We also have public awareness campaigns where community members are educated on malaria prevention and treatment options. We also have community-based monitoring where the local populations are involved in surveillance and control of malaria. Some of the challenges being experienced in malaria elimination include: one, healthcare access. We do have barriers that contribute to people or community members accessing diagnosis and treatment, especially in the remote areas. Some of them could be geographical barriers, financial barriers, cultural barriers, amongst others. We do also have a situation of drug and insecticide resistance, which is a big threat to the existing solutions. And we also have political and financial non-commitment, such as contributing to inadequate funding and government support, and therefore affecting the health system. So for future directions, we have a promising future when it comes to innovations in diagnosis, treatment, and vector control. About the malaria vaccine research, the ongoing trials has contributed, and implementation of malaria vaccine has contributed to reduction of severe malaria cases, especially amongst children. On sustainable solutions, for us to be able to sustain any interventions that we are applying as malaria team, it's important that we integrate malaria eliminations to the healthcare system and not leave it as a standalone. In conclusion, key to combating malaria in Africa, one of the things that is required, innovations in diagnosis and treatment. We need to embrace the use of new diagnostic tools in addition to the traditional tools of including RDTs and microscopes. We also need to embrace the use of the new treatments, both drugs and vaccines. Two, we need a multi-pronged approach, combining both prevention, treatment, and surveillance. And lastly, but not least, we need community-based solutions and local innovations for the purposes of sustainability. I would like to take this moment to acknowledge all African governments supporting malaria control activities, all African NMCPs, Global Fund, the WHO, Center of Disease Control, all private sectors involved in malaria control in Africa, and all African communities. Thank you for listening.
Thank you. Thank you so much. Thank you so much, Lilyana. This was great. And as I mentioned, if you have any comments, questions, please, I'm sure this has actually got us thinking. So we will be having comments and questions in the chat box and in the Q&A. Go ahead and put them there. And then when we get to our Q&A session, we will take care of those. So our next presenter is Kunle Rotimi, who holds a bachelor's degree in pharmacy from Ahmadu Bello University, Nigeria, and a Master of Science in Public Health from the University of South Wales, UK, and an MBA from the University of East London. With a strong passion for public health pharmacy, he specializes in procurement and supply chain of essential health commodities, including malaria and HIV/AIDS products. Kunle has over a decade of experience in public health procurement and supply chain management, and he has made significant contributions to improving commodity availability and distribution. He is a certified supply chain professional and a project management professional. And he is currently working as the team lead contract and grants with the government of Alberta, Canada. Kunle will be speaking to us on building a resilient supply chain for reliable access to malaria diagnosis and medicines. Kunle, please take over.
Yeah, thank you very much for that introduction. So I'll briefly be discussing with you on building a resilient supply chain for reliable access to malaria diagnosis and medicine. So as a way of introduction, as taking up from the background from the previous presenter, malaria still persists as a major public health challenge, especially in sub-Saharan Africa. And several publications has actually linked malaria to mortalities, especially in under 5 population. One of the most recent estimates of malaria cases shows that in 2022, we have about 249 million cases. And this has increased further. For example, recent publication for 2023 shows that we have about 263 million cases, indicating that the challenges for malaria, it's still there and it's still growing. Looking at it, going straight to the supply chain component, I want to create this background where we look at what are the key activities within supply chain. And one of the fundamental or the basic foundation of supply chain is serving customers. Looking at the cycle, it's actually one of the first and the most important features of a supply chain cycle, which is you want to make sure that you serve customers. And within the perspective of malaria, the customer in that sense will definitely be patient, or the population that needs several preventive malaria interventions. And this is this is actually the aim, the purpose, the goal of every supply chain system is to get whatever product, whatever commodities is needed to the customers and make sure that such commodities is the right one, is at the right doses, that's the right presentation, and also at the right cost. So within the context of malaria, we are looking at how to ensure that the basic right of logistics is ensured in ensuring that patients and also the population have access to malaria products. And in doing this, we also need to select the desired malaria product. And once a malaria product is selected, we want to sit down with all the relevant stakeholders to forecast and quantify the need for the entire population. Once that has been estimated, a procurement process can commence where identify potential manufacturers and suppliers of malaria products. And from then, once procurement has been concluded, there's need to store, there's need to manage the commodities, and also after storage, warehousing commodities, you also want to distribute those commodities to make sure that they get to the desired population. How is malaria intervention delivered? And in broad terms, we want to look at malaria program implementation in terms of the delivery of medicine and also the use of the long lasting insecticide-treated nets. In terms of medications, let's look at the seasonal malaria chemoprevention. This really has been within the malaria space since 2012, since the WHO actually recommend the use of the intervention to help reduce malaria morbidities and mortalities in under 5 children. It's actually in most sub-Saharan African countries, it involves the house-to-house delivery of malaria product. We usually use a combination of sulfadoxine, pyrimethamine, and also amodiaquine, which is delivered to children between the age of 3 to 59 months. And these interventions are proven to help prevent malaria within that age group. And within the context of supply chain, this is one of actually a challenging intervention which involve ensuring that these commodities, we call it SPAQ, gets to even the remotest villages across sub-Saharan Africa, since it's actually an house-to-house distribution of such malaria commodities. So definitely there's a significant supply chain component of that intervention. There's also the PMC, which is generally known as the perennial malaria chemoprevention. In this instance, it's actually it used to be IPTI, which is intermittent preventive therapy in infants. Here, we want to deliver malaria medicine, which is sulfadoxine pyrimethamine, to children under 1 year old. Currently, this intervention have not been scaled up, but within the context of supply chain, this intervention is actually currently being delivered as a facility-based intervention. So within supply chain, we ensure that those commodities get to the target health facilities. And there's also the ICCM, which is the Integrated Community Case Management. Here, it's an intervention that actually is delivered, is targeted at remote, hard-to-reach communities. And here we have malaria interventions being integrated in other essential health programs to ensure that hard-to-reach communities also have access to malaria treatment services and preventive services. So this is also a common intervention in most sub-Saharan Africa. We have the IPTP. This is targeted at pregnant women, and currently we are beginning to see the use of vaccine for malaria intervention. You would also agree with me. This will also ensure that those vaccines are available in a timely fashion at those intervention sites across sub-Saharan Africa, and also communities where this intervention is being implemented. And most commonly, we also have malaria treatment program. Here we have interventions that are delivered both in the private and public sector, where we understand the concept of test and treat, where malaria diagnosis takes place, where patients are tested and also treated with malaria product. And one also important intervention is the use of insecticide-treated net. Within the context of African countries, we have campaigns, which also entails house-to-house distribution of mosquito nets to household. And this also have a very challenging supply chain component. So these are common interventions that also involve a significant distribution and supply chain of malaria commodities. And within the context of supply chain and also malaria program intervention, I just want to briefly, I want us to look at the key malaria functions, the key malaria activities that historically have been shown to be part of malaria intervention across Africa. For example, number one, we have forecasting and quantification of malaria health products. For example, in Nigeria, we have forecasting and quantification committee that meets routinely to quantify malaria product for both public and private sector. This involves using several factors and several data to come up with the malaria commodities requirement for both public and private sector. It helps in planning, especially if there's funding to procure those commodities for the public sector, even though it has been challenging in the sense that the quality of data for some of us, you will know that the gold standard for quantification and forecasting is usually consumption-based, but still the integrity of data in Nigeria is still problematic. So most of the time we go with demographic and mortality and morbidity based quantification. Procurement and quality assurance, this is also vital within the supply chain of malaria health products, where we source for malaria commodities and making sure that whatever commodities are being sourced, they are of good quality in line with WHO recommendation, and also in compliance with the recommendation and also the regulation of the regulatory bodies in the country that is actually sourcing those malaria products. Distribution and inventory management, this is also a significant activities that are being carried out within the malaria programs. And one other important aspect is the LMIS, also known as the Logistic Management Information System. Within supply chain, this is seen as the heart, as the center of most supply chain system. And in malaria, it's important because it provides the information, it provides the data that helps drive the entire supply chain. It provides data that routinely is supposed to inform the other activities within the supply chain. So this is also one basic and very important component of supply chain in malaria programs. Let's now go to a resilient and sustainable supply chain. When we talk about a resilient supply chain system, we are looking at one that can withstand changes, that is agile and adaptable. We are looking at a system that is able to consistently ensure an uninterrupted availability of malaria health product. So regardless of the environmental situation, regardless of the policy situation, regardless of even natural disaster. So for us, in ensuring a successful fight against malaria, in ensuring the successful eradication and elimination of malaria, there is need to ensure the availability of a resilient supply chain system. So I want us to look at these 5 key components of a resilient supply chain system. What do we expect from a resilient supply chain system? We want an agile and adaptable system, which means regardless of the political situation, regardless of the change of government, regardless of a scourge in demand for malaria commodities, the system should be able to still ensure that malaria health products are available at the right time, at the right place, at the right quality. In short, it should ensure the fulfillment of the 6 rights of logistics. And one other features within a resilient supply chain system is effective coordination of collaboration. For a logistics system, for a supply chain system to be resilient, and especially within the context of malaria program, it is expected to have a seamless, a good coordination and collaboration within the public and private sector. In terms of suppliers, we also expect to have strong relationship. And also in terms of inventory management, there should be good inventory management practice that will ensure commodities are available at the right time. And most importantly, a resilient supply chain system should be data-driven. We should not be making decisions based on empirical evidence. We need to use data to drive the entire supply chain system, because this will ensure the effectiveness and efficiency of the supply chain system. And I want us to look at a brief, we have a number of challenges for malaria supply chain management, and especially in developing countries. But this is just a brief highlight of some of those challenges. Currently, within the malaria supply chain system, we have human resource constraints. And this, in terms of the number, and also in terms of the quality, in terms of how skillful those human resources are in managing malaria commodities. Another very vital challenge is actually the presence of counterfeit and substandard product. Discussing with colleagues, it's clear to us that malaria commodities are actually one of those commodities that have market value. Because we have high malaria cases and we have commodities that are available for treating them, and they are readily available. So the potential to have those commodities being counterfeited is actually high. So looking at it, it's a big challenge. And so in several studies, there are a lot of research studies that have been carried out, which shows that malaria commodities actually represent one of those commodities that are substandard in the market. And we also have counterfeit and also known as fake products in African markets, especially. We have funding gap, and most malaria programs are donor-driven. And for some of us that are aware of what is going on with the politics in the United States, malaria program is actually one of the programs that are actually receiving the boots. Malaria programs in most African countries, we're having significant cutting of funds for those interventions. So funding gap is a major challenge, and going forward is still going to be a major challenge. Data is also a major challenge. For example, having discussion with the experts shows that even in this century, we are still using models to estimate malaria cases and malaria burden in sub-Saharan Africa. And one of the reasons for this is that we don't have quality data that can be used to give us an actual estimate of the burden of malaria in most developing countries. Stock out of malaria commodities, which will definitely continue because of a drop in funding, availability of funding. We also have inadequate last mile distribution system. The distribution system within the public and private sector is chaotic. For example, in Nigeria, currently, the traceability of malaria commodities, especially in the private sector, it's actually not there. We don't have visibility into what's going on, where most malaria commodities are actually going in the Nigerian market. Why do we need a resilient supply chain system? As I earlier said, to ensure an uninterrupted availability of malaria health product, it is vital to have a resilient system. And it is also important to note that when we have an uninterrupted availability of malaria commodities, it will also help in the eradication of malaria. So looking at what is important in terms of eradication of malaria and how the availability of commodities is vital in that fight, you will agree with me that having a resilient system is central to ensuring the fight against malaria is successful. What are the features of a resilient supply chain system? Some I've mentioned, but I just want us to look briefly at some of the key features. In procurement, we want to use the principle of strategic sourcing and should be a major component of a resilient supply chain system. In strategic sourcing, we want to make sure that what is actually driving our decision, our sourcing decision, involve ensuring that we achieve the goal of ensuring the eradication of malaria is achieved. For example, in strategic sourcing, for example, we try to diversify. And we try to diversify and ensure that we have a reliable source for malaria commodities, especially quality malaria commodities. And also having ensuring that we are also sustainable in terms of local production of malaria commodities is also vital, while also ensuring that partnering with manufacturers and also aligning our goals with suppliers of malaria commodities is sustained. Forecasting, as I've said, this should be data-driven, and data-driven required quality data that are accurate and we provide the true picture. Inventory management, introduction of technology in terms of warehouse management system and real-time tracking will help ensure better visibility and also help better management of malaria health products. Distribution network is also vital, as I was also mentioned around how we can explore digital system that will help help us have better visibility into the supply chain pipeline for malaria commodities. And just like I mentioned, the challenges in the private sector require better visibility. So if we have a more robust and comprehensive logistic and distribution network, it will help us understand how to better manage the pipeline for malaria commodities. And doing this will help identify and prevent the adulteration and also faking of malaria health products and reduce the availability of substandard products in the market. One core feature is also exploration of technology, which I've mentioned, and the concept of artificial intelligence can also be used in predictive quantification of malaria commodities. This will help in ensuring that we have a better picture of the need of individual country where malaria is a major factor, major challenge. And importantly, we need to implement mobile solution for tracking malaria products. And let me also mention one issue within malaria program also involve the filtration or the flow of public sector commodities that are originally donor commodities into the private sector. This is a major challenge. I believe if we have better visibility into some of these commodities, it will help stem and prevent that flow. And coordination and collaboration. This is essential between NGOs and private entities, and also help creating a platform where public-private collaboration will be sustained. This will help to ensure the fight against malaria is effective, and also will help ensure that commodities, especially quality commodities, are available for use across the malaria-burdened areas. Regulatory compliance within the public sector, for example, in Nigeria, especially for those donor-funded products, there's a standard of ensuring that products that are procured are WHO certified. So it's already a policy within the public sector, especially for donor commodities. So we are sure that commodities within that sector, especially those that are donor-driven, are of good quality. But there's also an issue with the private sector where we have an array of commodities, even though some of the regulatory bodies are doing enough to ensure that the private sector is also of good standard in terms of the quality of commodities. So for us, within this resilient supply chain system, it's important to ensure regulatory compliance and quality assurance is also sustained. Also, I having been able to being opportune to participate in several studies, it is important to look at the fact that most substandard products are actually more in rural areas, even though we also have significant number of them in the urban centers. But when you look at the socioeconomic stratas, most of those fake products are more attractive in areas where we have population of lower socioeconomic status. So it is very important to ensure that we improve quality monitoring, especially of the pipeline of malaria commodities. And this will involve improved monitoring in rural areas and also within the private sector. Strengthening human resource, just like I mentioned, one of the major challenges is human resource, and establishing a system where we continuously build the capacity of health workers and also within the private and public sector will be vital. For example, in some African countries, we have patent medicine stores that are also expected to provide certain malaria services. Based on some studies that have been carried out, some of these staff, some of these workers within that sector, we need to have improved capacity so that we ensure that in the supply chain management of these commodities, it's up to standard, and also to ensure the quality availability of these commodities. What are the roles of pharmacists? Definitely, over several years, we've had pharmacists move into supply chain, especially in non-profit organization. I was opportune to also work in non-profit organization as a pharmacist. I will assure you that pharmacists has a role to play, especially because of their understanding of medical products. So pharmacists are more tuned. They are more skilled in managing health products. So that's why having pharmacists in supply chain is really a perfect fit. However, I would also want to say that for pharmacists to succeed in that sector, there is need to have more training in supply chain. Explore the possibility of having certification and also attend trainings on supply chain. Most importantly, pharmacists has a vital role to play in quality assurance. In my experience, I see how the importance of my role as a supply chain person, as a pharmacist who is in supply chain, in ensuring adherence to standard. I see myself in handling those malaria products, and also in making procurement decisions. I ensure that certain quality standard is maintained across all the supply chain functions. So I would also like to mention that pharmacists has a vital role to play in quality assurance and also data collection and reporting. Because of the desire to ensure the availability of quality product, I've also participated in several surveys that looks at how we can monitor the various channels through which malaria products get to the public. This includes private pharmacies, patent medicine stores. These are areas pharmacists can use their knowledge and understanding of medicines to contribute towards in ensuring the availability of a resilient supply chain system. And most importantly, pharmacists has a vital role to play in rational use of malaria medicine. I would want to mention this because currently, in most developing countries, we also have irrational use of malaria medicine. The recommended standard is to have test before treating, but we all know what happened within our environment, where clinical diagnosis is usually the order of the day. And pharmacists can help bring a change around this to ensure that malaria medicine are actually used rationally, and not only in terms of not complying with recommended standard, but also in terms of ensuring that people use malaria commodities that are expected. For example, in most studies that have been carried out shows that malaria commodities that are originally designed that are classified as monotherapy are still prevalent in the private sector in the market. And we all know that the recommended medication for the treatment of malaria is actually combination therapy, most importantly, the ACTs. But we still have a lot of monotherapy in the market, especially in Nigerian market, as a fallout of one of the studies that was carried out. And this also shows that we have irrational use of malaria commodities. So most importantly, we can look at how we can explore certain innovations within this context to ensure that we have a resilient supply chain using digital application, mobile application for traceability, improve partnership, and also use of drone for improving access to hard to reach communities, and also platform for data sharing, which also speaks to collaboration and also coordination. And in conclusion, these are four key points I want us to take home in terms of how we want to ensure that we sustain a resilient supply chain within the context of malaria program. A resilient supply chain is essential for ensuring uninterrupted access. With a resilient supply chain, we can ensure uninterrupted access to malaria products. We need to look at these four areas, integrating them together: strategic sourcing, technology, risk management, collaboration, and stakeholder engagement can help strengthening and ensure resilient supply chain. A resilient supply chain must be designed to be flexible and adapt to consistently changing circumstances, such as changes in demand for product or changing in funding policy. For example, within the current changes within United States should not affect the uninterrupted availability of malaria commodities if we have a resilient system in place. And finally, we need to have continuous improvement, and innovation should be a culture, and this will ultimately help achieving the eradication goal, and also safeguarding public health. Thank you.
Thank you so much, Kunle, for a very extensive presentation. We will jump in quickly. I mean, I'm sure we have comments. I've seen a few questions in the Q&A, and I'm looking forward to a very interactive session. Our next presenter is Olushola Onanusi, who is a skilled community pharmacist dedicated to enhancing pharmaceutical care and improving community health outcomes. She's a graduate of the University of Lagos and has gained significant clinical pharmacy experience in her work. Her expertise has further been developed at the Bowen University Teaching Hospital, and she has collaborated in a multidisciplinary team to improve therapeutic outcomes. She's currently pursuing a master's program in clinical pharmacy, and she is the operations manager at Victory Drugs Pharmacy. In that capacity, she advocates for patient-centered care and ensures the delivery of optimal pharmaceutical outcomes. Olushola is a registered member of the Clinical Pharmacists Association of Nigeria, and she'll be speaking to us on strengthening the pharmacist role in community engagement. Olushola, please take over.
Thank you so much, Yvonne, for the warm welcome. Thank you so much, and I'm glad to be here today. I'm especially grateful for this opportunity, and I'd like to thank the two speakers that started. They did a very good job, and they've made mine a lot easier. So today I will be talking on strengthening the pharmacist's role in community engagement, and we'll get right into it. Now, as has been already talked on, nearly half of the world's population is at risk of malaria transmission. And over the past few years, we've noticed an increase in, the malaria cases and incidents. So it's still a major public health concern, malaria. And it's been observed that, the more vulnerable population seem to be children under 5 and more so pregnant women. Now, Nigeria is one of the countries that have the high incidence of malaria, and it's as bad as 49% incidence in some regions of Nigeria. Now, as has also been spoken, we can see the high burden of malaria disease globally. And according to the World Malaria Report, in the African region, we have some countries that have contributed significantly to this high incidence of malaria in the world. And this also speaks to that also. Now, Africa seems to have a high predominance of malaria, and a number of things contribute to this, including the local weather condition that, just seems to facilitate breeding of mosquitoes, limited resources, and socioeconomic instability, amongst other factors. So on the socioeconomic impact, also it affects both individuals and the government at large, in terms of expenses on treatment, expenses lost also based on the basis of missing work, lost days from work, children's absence from school, costs even for treatments. And in terms of the government, implementation of public health interventions, all of these are expenses that really are on the account of malaria. So what exactly is the role of the pharmacist in all, in the grand scheme of things? Now, I like to start with a funny story. I heard of a child that was asked who a pharmacist is, and well, the young man just boldly says, "Oh yeah, a pharmacist is someone that sells drugs and provisions." And it just struck me that could this be the perception that a lot of people have, that pharmacists are just people that procure medications, dispense medications, and that's it. There's been a great shift in the role of the pharmacist for a long time, and really it's much more than dispensing and procurement. Now, these are some of the roles of pharmacists today, particularly community pharmacists. I'm a community pharmacist, and a number of all of this we do: drug dispensing, patient counseling, point of care tests. And the essence of all of this is to make care accessible to the patient. The end goal of all of this is to make sure that there are better health outcomes for everyone. Now, it takes me to the fact that pharmacists are the most accessible. They are known to be the most accessible healthcare professional in the community. In Nigeria, community pharmacists are especially the first point of contact for a lot of people. They run to the pharmacy first before they go to the hospitals. And studies have shown that patients visit their community pharmacies approximately 1.5 to 2 times as often as they visit their physician or other healthcare professionals. So you see that the community pharmacies, even the hospital pharmacists, every arm of pharmacy is important. As we all know, the ultimate goal is to have a malaria-free world. And to achieve this, prevention, early diagnosis, and prompt treatment of malaria is, they have to work together to reduce disease, to prevent deaths, and contribute to reducing of this transmission of malaria. So all of these are important factors that would bring the end goal of a malaria-free world. But how do we get there? It's recommended by WHO that before you treat malaria, a prompt parasite-based diagnosis is to be conducted on any and every suspected malaria case. Now, in Nigeria, a study showed that almost 60% of outpatient hospital visits and about 30% of hospitalized patients are on account of malaria. It also showed that, for approximately 50% of the Nigerian population is expected to suffer at least one episode of malaria annually. And more so for children, they have an average of 2 to 4 malaria attacks every year, which is significant, really. Now, where do pharmacists come in? Access. point of care. Point of care really is just care at that point in time, Point of care can be given at any point in time. When your patient comes, I'm having so symptoms, classic malaria symptoms. What do you do as a pharmacist? What is your role as the pharmacist? Suspected malaria tests are recommended to be confirmed either through microscopy or rapid diagnostic tests. And in all of this, RDTs are very easy to conduct. So why not do this in your pharmacy? Why not do this in your clinic? It's even more interesting in a community pharmacy, because really it may not be the person that wants to take the medication that comes. In Nigeria, for example, malaria medications are over the counter. So anyone comes, oh, I want to get a malaria medication. It's up to the pharmacist to ask questions, and find out if at all it's not the person that wants to use the anti-malaria that came. Why not engage the person? You can take the point of care home. Home service is something that is done, and the essence is we want to make sure that health outcomes are improved. So RDTs, can assist in making sure that you test before you treat. Now, in the community pharmacy, you can do your RDTs, you can do your temperature checks, amongst other points of care tests. Now, it brings me to another role of the pharmacist, which is in prevention. Malaria awareness is one part of prevention that is very important, in that as much as possible, the community needs to be empowered. They need to know the implication of certain things that go on. They need to understand the implication of malaria, because it's just seen as a common, I have a fever, oh, my body aches, and well, in 3 days, assume, it's just assumed that in 3 days I'll be fine. But really, people need to understand the implication of malaria. They need to understand that malaria is preventable, malaria is treatable. So community empowerment activities, need to be carried out by the community pharmacist or by the hospital pharmacist, even by every arm of pharmacy needs to be involved. Because information is power, knowledge is power, and we need to actually make sure that the community at large is properly taught on malaria prevention practice, how to properly use insecticide treated nets, and other protective measures against malaria vector. Also, promotion of personal and environmental hygiene. Now, growing up, I remember we used to have this environmental sanitation programs where there's a day dedicated every month to cleaning your environment. And it's particularly, it's compulsory, it used to be compulsory, because every business is halted until, environmental sanitation is done. And what was the essence of this? To make sure that, intentional cleaning is done. All those gutters that, can cause stagnant water and things that, will aid breeding of mosquitoes. Those things are intentionally removed off on those set days. And people are educated because people gather and they're cleaning. So it's an avenue for the pharmacists to speak and let them know, okay, this is why we're doing this. This is what we hope to achieve. And this is why we need to keep it clean. Pharmacists also come in the provision of intermittent preventive treatment for pregnant women. Also in seasonal malaria chemoprevention. Now, it's been spoken on by the previous speakers, and SMC is something that is very important, particularly in areas where malaria transmission is highly seasonal. Pharmacists can come in here in terms of pharmacovigilance, distribution, making these medications even available in the first place. So supply chain is very important here, and the pharmacist is important here. So SMC is another aspect that the pharmacist can come in, supplying of these medications, pharmacovigilance, and even adverse events monitoring. Also, pharmacists can be very useful in drug counseling for travelers. Travel history is very important in malaria prevention and control, really, in terms of movement from a non-endemic, non-malaria endemic environment to a malaria endemic environment and vice versa. So the pharmacist is very important in that. Now, another thing is that pharmacists are drug custodians, in as much as, we want to ensure that people are comfortable and all of that. We also need to safeguard medications. It's very, very important that we guard against misuse of anti-malarials. Presumptive treatment seems to be the order of the day in sub-Saharan Africa, because it's just assumed that every febrile illness is malaria, and this could lead to it is leading to overdiagnosis and consequently overtreatment of malaria. So please, not every fever is malaria. It is recommended that you test before you treat. And also, in treating malaria, in quotes, you may end up delaying treating what actually is the problem, which may cause more harm than good. Now, another role of the pharmacist is health education. Pharmacists are, trusted health advisors. People listen to the pharmacist. I've once heard that, a funny analogy when it comes to medications. When you swallow a pill, you are the boss before you swallow the pill. You are the boss before you swallow the pill, but once you swallow the pill, you can't do anything about it. Well, except maybe you throw it up, and that's if it's not something that is immediately releasing. You can't do anything once you swallow the pill. And if you don't know about what you're swallowing, whatever, things just start to play in your mind, and what is not, you start thinking it is, so information is very important. And the pharmacist's point of view when it comes to medication is important to the patient. And that's where I want to speak on public health, patient education activities. Pharmacists can actually intentionally engage patients in that when patients come, whether they come to your space as a community pharmacy, or when they come to the hospital pharmacy, counseling should be done before their medications are dispensed. If you see they are being given anti-malarials, you need to talk on vector control strategies. You need to talk on proper environmental hygiene. Also on public health advocacy. Pharmacists are important in terms of data collection. Data collection is a part of this prevention and control, because in your niche as a pharmacist, you can gather information. You can find out what time of the year do I tend to dispense anti-malarials the most. If you want to probe a bit further, you can find out, are there more males in the month of this than more females? Are there, try and, take information. Data collection is very, very important. And these things can help us to monitor trends that may eventually affect health policies. In conclusion, I would just like to state that pharmacists are important stakeholders in malaria prevention and control. Personal and environmental hygiene are significant contributors to malaria vector control. Not every fever is malaria, so it is encouraged that you test before you treat. Prevention, early diagnosis, and prompt treatment of malaria reduces disease, it prevents deaths, and contributes to reducing transmission. Thank you so much for listening.
Thank you so much, Olushola. Please, can I ask all the speakers to put on your cameras so that we can... we have a few questions in the Q&A, and I'm sure that as we go through them, a few more will come up. So we'll just take them one at a time. The first question is that the best strategy is obviously prevention over treatment. What do you feel is the main barrier to prevention? Is it lack of medication, lack of education, or something else? And I think perhaps I'll just go through them. And then while I'm going through them, I will ask the various panelists. I'll identify the panelists that I'm proposing to answer. And then, of course, if another panelist wants to add something else, we will do that. But please put on your videos. So this question, I think, Lilyana, we may want you to answer that. Then the second question is, what is the success rate of ACT? And once again, Lilyana, I think it will come to you. The third question is, how far are we from achieving the WHO goal? You mentioned it in your presentation. It looks like we're only 5 years away. How far are we from achieving it? Do we have any data from the vaccines that have already been administered? Are the vaccines freely available since they have highly impacted areas? Since highly impacted areas are in poor countries, as you indicated. Also on how far we are, perhaps, well, Lilyana, take that for us. Olushola, the success rate of ACT, I don't know if you want to comment on that. When it gets to your turn, you can make a comment on that. We have another question. How can we make RDTs more accessible for deserving communities? It says in Nigeria, but I'm sure it affects all of us. I mean, I think the scenario of not having access in hard to reach areas is real for all countries in the global south. So I won't limit it to Nigeria, but to all of us. And Kunle, I think you can take that for us, looking at it from the supply chain angle. I believe, Kunle, you also mentioned technology. Well, I suppose that the matter of technology, all of us can respond. How we can actually use technology, considering that in a lot of countries in the global south, there are challenges actually with respect to access and effective use, and even issues on data protection. So how can we really, in practice, use technology when we are talking about malaria prevention? I think I'll stop here and I'll ask that we go through it the same way as the presentations were made. So Lilyana, you will start with your comments, then Kunle will come in, and then Olushola will also come in that order. Thank you.
All right, thank you once again, Dr. Yvonne, for this great opportunity. I will try and respond to some of the questions that have been asked, and I'll begin with the one on some of the challenges we are facing in with regards to prevention of malaria burden. So I will try and be systematic. Some of the prevention interventions we have in most parts of Africa include through the use of ITNs, the insecticidal treated bed nets. So you find that in many countries, despite the fact that the coverage could be optimal, maybe above 80%, many of the people do not use the bed nets. There are so many issues, cultural barriers that affect the proper net use, therefore still exposing the people to mosquito bites and, of course, malaria disease. Then when it comes to indoor spraying, which is one of the tools we use for prevention, it's very costly. And most countries have been getting support from abroad, specifically from Global Fund and USAID. And we are all aware of what is happening right now. Most of the Global Fund and the USAID is a bit shaky at the moment. Now, about malaria vaccine, which is also another tool that we're using, you find that these children, most of them come for the first malaria vaccine and the second. But now when it comes to the continuation phase of the third and the fourth malaria vaccine, we start losing these children. And in most countries, you find that the uptake of the fourth malaria vaccine is hardly above 20%. Then we also have larvicidin, which is a tool that can be used, but again, it's not being effectively applied in most parts of the continent. We have SP, sulfadoxine pyrimethamine, which is used for prevention of malaria in pregnancy. And once again, you see that in many countries, the pregnant women will only come for the first dose of the SP, maybe the second. And now when it comes to the third up to the eighth, we start losing them. And therefore makes it a bit challenging for us to be able to fully implement malaria prevention tools. So how far are we? And generally, most of these interventions are affected by resources. Countries not being able to afford some of these interventions and rely a lot on donor funding. So how far are we from achieving the WHO goals? Well, I think this is a different in different countries is different in different countries. So the countries that have been able to fully implement the prevention and treatment strategies, they are closer to achieving the WHO goals. Like for instance, in Kenya here, we already have some regions which are now in the elimination phase, whereas there are some which are in the control phase. So in different countries have got different stages towards in achieving the WHO goals. Thank you. I didn't get the second question. Maybe if you could repeat it sometime later.
Okay. Thank you so much. Thank you very, very much. Kunle, please, you make your comments and then we'll come back to Lilyana.
Okay. Thank you very much. In terms of access, I want us to look at it from the various components of access to health products. First, let's look at the affordability component. If people can't afford medicine, definitely they won't have access to it, especially for RDT. There are a lot of projects that have actually been implemented to help address access to malaria health product. For some of us that have been within the public health space would remember the AMFM malaria project. That's affordable medicine for malaria. We also have ACT co-payment mechanism that were these projects were implemented about more than 10 years ago. This involve ensuring that malaria products are available in private sector in a subsidized way. So during those period, that project was able to ensure that create a scenario where even other malaria products were we ultimately were able to bring down the price of malaria in the market because they were funding that flooded the market with subsidized, reduced cost malaria product within the market. And in doing this, the project involved collaborating with private sector in terms of malaria product manufacturers who were able to ensure that products were available across most countries where we have high malaria burden. So this was able to ensure that malaria products, especially the quality assured ones, were more accessible and affordable for the population. So for me, sustaining and continuing such projects will help address affordability component of access to malaria product, especially RDT. And in terms of RDT, I also want us to look at the acceptability component of RDT because acceptability is also a component of access. And in most areas, I would tell you, I've seen clinicians who still don't believe that they need to use RDT before they start treating treating with anti-malaria. So these are issues, and to address some of these accessibility issues, we still need to keep training and ensuring that we orientate people on the need to test. And even in some instances, some clinicians, even after testing, they still don't believe in the RDT results because they still relies on their clinical diagnosis. So acceptability is still an issue. But in terms of the supply chain component of that, making RDT available to remote areas, I will tell you that the ICCM project was originally designed to implement malaria project in hard-to-reach communities. So within the public sector side, there are projects that we need to continue to help improve access to to RDT in especially remote areas. And also, I also want to mention in terms of the supply chain component, there are innovative ways that within Nigeria and some African countries in partnering with private sector. For example, introducing private sector solution in public sector, or introducing private sector solution to ensure that malaria commodities RDT gets to the remote areas. So I will just give an example about Coca-Cola. Most within the supply chain sector, we try to partner with Coca-Cola and also beverage companies, because we know that these beverage companies, when you go to every areas of the country, you will have those product being sold there. So the idea of partnering with them to ensure that we leverage on their supply chain system or learn from their mechanism to ensure that malaria commodities get to the remote areas across the country. So those are areas where private-public partnership can help ensure that malaria commodities get to the remotest area in any country. And let me just conclude with the need for pool procurement mechanism. That this is a strategy within the public sector that has ultimately been used to bring down the prices of malaria product. Pool procurement in the sense that you pool all the need across the country and go to the manufacturer. Through that, you will be able to get a volume discount on malaria health products that you're trying to procure. And this is mainly done within the public sector. So currently now, there are discussions on how to ensure that you include private players into that pool procurement mechanism where you have an expanded volume of malaria commodities need across the country in both public and private sector. So you go to the manufacturer, we're able to get a discounted price that can be sold at a reduced rate, even in the private sector. So these are some of the discussions that are currently going. And something just came to mind about what is currently happening, what is used in some parts of Nigeria and also in African countries where we are currently exploring using drones to deliver malaria health products. So this is also one area that has been explored. Thank you very much.
Thank you so much. Olusholo, I think you can address the one that Lilyana missed. That is how effective ACTs are if you have that information. Otherwise, when Lilyana comes back, she can speak to that. And then perhaps there's another question here about mobile populations. Your presentation focused quite a bit on really stationary, because as a pharmacist, you are in a community pharmacy or in a hospital. But how do we deal with mobile populations when it comes to malaria? If you have any thoughts in that area, please share them. And also on the use of technology. Do you have any thoughts on how we can use technology to, leverage technology, considering the limitations that we have in our system? Thank you. Please go on.
Okay, thank you so much for the questions. On the effects of in relation with the mobile space. Now, when it comes to patient engagement, you don't necessarily have to wait for the patient to come to you now. Technology makes everything easy, in that, from your own space in the pharmacy, you can actually get prescriptions and all of that online. So if you can get that online, from your own space, why can't you reach out to the patient online? We see the likes of, things going on social media right now. And that's usually a means of sometimes misinformation to people. As the pharmacist, we're supposed to be the voice of reason, in that we can also use technology to pass information, that the right information when it comes to malaria prevention and control, when it comes to treatment. Now, because really, Kunle mentioned something about acceptability. Some people don't yet accept the fact that ideally it should be artemisinin combination, therapy that should be used in the treatment of malaria. And because of that, some of them can, they move to you get treatment failure because you may have used a single artemisinin medication, and by the time you get a treatment failure, oh, the malaria medicine didn't work, whereas you didn't do the right thing. So technology comes to play in that. As a pharmacist, I can create, a safe space for my clients. When they come into my pharmacy, we can actually have an information section where you have patient information bulletins. You have short tips on what to do for vector control. You have short tips. Okay, now that I have malaria, what do I do? Oh, I'm done treating my malaria. What happens, next, to prevent this from happening again? And also, from your own client, you can also even reach out based on, okay, I just remembered something that Association of Community Pharmacists of Nigeria, they do, they liaise with the local radio stations, and there's this thing we do every Tuesday, 30 minutes with the pharmacist. And that's just a way of reaching out to the general public on certain topics. You know, we do different topics. We talk, sometimes it's on sleep, sometimes it's on different, you know, but with that, you can reach out to the general public and, you know, communicate appropriately on the right information, sending out the right information to people. So I think that's my comment for now.
Thank you so much. Lilyana, I would like you to come back. There is one question on how effective the vaccines are. If you can talk about that. Yes, okay. So we've heard quite a bit about the challenges with the ACTs, but I think the question still remains: are they really effective? Just give us some information on that. Somebody also wants to find out about antimalarials that are safe in pregnancy other than sulfadoxine pyrimethamine. There is another question. You can tackle it if you feel comfortable with it. And also maybe Kunle and Olushola can deal with that question as well, as to why it is that sometimes when the patient, you test with the RDT and it is negative, and you give the patient the medication anyway, of course, that brings in the question of accepting the results. I mean, the pharmacists are also not accepting the results. If you give the patient the medication anyway, they start to feel better. Why is that the case? So if you can attempt these questions for us, thank you.
All right, thank you very much, Dr. Yvonne. I missed that. I'll start with that one. So how effective are ACTs? So artemisinin-based compounds have been very, very effective, I think, for quite some time, if I'm not very wrong, for almost 10 years. Because like in Kenya, they were introduced in 2010 and they've served us well. But there have been instances where resistance has been reported. And therefore, many countries, I know Malawi is one of them, Burkina Faso, have already started introducing the multiple first-line treatment, where they're now rotating the artemisinins because they do not want the resistance to set in completely. So you find in some countries, for instance, they are rotating artemether lumefantrine with artemisinin mefloquine, or artemisinin amodiaquine, or artesunate peronaridine. So artemisinin are very effective, yes, but from a clinical perspective, the instances of resistance being reported, and countries have been advised to start rotating the drugs so that we're not again in that situation of drug resistance like that of chloroquine and the other drugs we had previously. Now, about malaria vaccine, Kenya, Ghana, and Malawi were the countries that piloted this vaccine. And I know sometime in 2021, I think 2 years after we had piloted it, the WHO announced that indeed it was a tool that had really contributed to the reduction of malaria severity, especially amongst children. It is a very effective component or tool, as we have, as I mentioned earlier, is on the uptake, especially of the third and the fourth doses. Many caregivers, especially the mothers, do not bring their children for the third and fourth doses. Sometimes you find that the mothers are already pregnant, or there's no other reason, according to them, they need to bring the child back to the clinic. So it's a good tool that, when used very well with other interventions like proper bed net, prompt care when the patient is unwell, it can reduce the burden of malaria. Then about the safety of SP, of course, it's a sulfonamide, and I know Dr. Yvonne and the other pharmacists are in a better position to talk about it. It is a good drug, especially to patients who are not sensitive to sulfonamide. And about alternatives, well, most of the time in Kenya, if the patient is not eligible for SP, we do encourage them to use the other malaria interventions, such as proper bed net use, or when they feel unwell, they immediately come to the hospital for testing and treatment. About RDT, when it is negative and you give the patient antimalarial, they feel better. Well, there is a lot of politics around this. So I think I would insist that we stick to the treatment guidelines, where if the test is negative, then we assess for other conditions that may be presenting with fever or any other symptom that looks like malaria. Otherwise, if we keep on insisting that the patient could be having malaria even when the malaria test is negative, then we are risking misusing or wasting resources, especially the antimalarials. And again, we are risking facing drug resistance, especially with regards to antimalarials.
Thank you so much. And I think that some of the things that you were mentioning as the issues, really it comes back to what pharmacists can do, because we see that there's a lot that comes from the information that the community members are not aware. Why should I bring my child again for the third and fourth doses? But so often these community members will go into the community pharmacy for all sorts of things. So then the community pharmacist at that point should be in the position. You see a woman of childbearing age, or somebody who comes into the facility, somebody who looks like a caregiver. I mean, we just have to be presumptive and start talking to them about children, about these vaccines and how to even use the medications that they are being given properly. And I think that when we leverage that access that we have to the community as pharmacists, we will be able to help in curbing some of these challenges with misinformation. And I mean, if the person feels that my child is fine after 2 years, I've been coming for postnatal care, after 2 years the child is fine, there's no problem, they don't feel the need. But perhaps if we step in as pharmacists who have access and who are trusted healthcare professionals in the community, and we engage them, they will understand that, let me take the time off and take my child for that care. I think that, thank you very much. I don't know if you or perhaps Olushola will want to comment on drug resistance and what we can do. The fact that the resistance, it's coming up. You have mentioned some of the responses that some countries have started using to limit it, rotating the first line and all that. But what else can we do? And then what can we do as health pharmacists who are healthcare professionals who are in constant touch with the community members and who are also trusted healthcare professionals? What can we do? So perhaps you can say something and then Olushola will also comment on that. Thank you.
Oh, thank you very much, Dr. Yvonne. Maybe I'll mention briefly some of the things pharmacists may do. Of course, one of them is surveillance and monitoring. There are some countries where therapeutic efficacy studies are already going on. They're very effective in informing them in pockets where resistance has already been picked. Then, in addition to that, we also have need for strong regulations, where we emphasize on the need for whether it's public hospitals or private chemists or clinics to adhere to the treatment guidelines. When a test is negative, then they need to assess for other conditions. But when it's positive, then they can give an appropriate antimalarial. So there's need for strengthening of the regulations and quality control. Because again, we have a lot of fake drugs in the market and or counterfeit or substandard, which again are affecting the health of the people we serve. Also participate in development of new drugs. I know that those advanced countries, their pharmacists have participated in development of new drugs. I think those are my submissions in the case of drug resistance. Thank you. In addition to rotating of the first line treatment. Thank you.
Thank you very much. Olushola, I'll give you half a minute if you have something to say.
Okay, thank you, Yvonne. Okay, so in addition to the strong points that Lilyana gave, I would also add that sometimes misuse of the medications by the patient in question can be one of the reasons why the medication didn't work in the first place. I'll explain an instance I had when a patient called and was scared. Oh, I need help and all of what's the problem? I bought artemether lumefantrine, a pack of 68480 yesterday morning, and it's this morning I've exhausted it. And I started asking, how did you take it? You know, how did you take it?
Yeah.
And he said, yeah, and it's 8480. He said I took 2 tablets in the when I got it, and 2 tablets the next time. So he was using two tablets, double the dose. And you've not addressed the issue. And at the same time, you've also exposed yourself to what you shouldn't have. So sometimes it can be misused from the patient, number one. Other times it can actually be that the patient is also maybe possibly a food drug interaction or a drug interaction that they won't tell you about. So it's up to the pharmacist actually to engage the patient properly, to be sure. And also my last point is if it's not malaria, it's not malaria. If you test and it's negative, then it's not malaria. Focus on
Thank you.
something else that may be more harmful. Thank you.
Thank you. Thank you so much. That we have a proverb in Ghana that literally translates as, when the conversation gets more interesting, it turns dark for the villagers. So it's time for us to close. I mean, we've had an exciting time. It's been very informative, and it's been wonderful. I know that some questions were not answered because it was exciting. There were so many questions and so many comments and all that. But we will want you to check out this page, events.fip.org. Look at some of the upcoming events. There are so many events to equip all of us in doing our work. And please visit this site and see what we are doing. And don't forget, the 83rd FIP World Congress of Pharmacy and Pharmaceutical Sciences is coming off in Copenhagen from the 31st of August to 3rd September. Be there. Pharmacy forward, performance, collaboration, and health transformation. I know that we have issues, but please make sure we get there. I'm sure that those of us who were able to have already submitted our abstracts, and we've received responses, feedback on our abstracts. But these are the themes, and so bear them in mind. Making it sustainable, making the system work, making it personal. These are the 3 sub-themes that we'll be tackling in these at FIP Congress. Please remember the deadlines. Early registration fee deadline is 2nd June. If you don't want to pay too much, please, 2nd June, by 2nd June, you should have registered. And then the second registration deadline, for some reason you are unable to meet the early registration, go to the second one and make sure you meet it. And let's meet in Copenhagen this year and enjoy ourselves once again, learn and socialize. Thank you for attending, and hope to see you all in our next